The following educational video was created in collaboration with the Faculty of Biomedical Engineering and the General University Hospital. Blood sampling from inserted catheters. Blood collection can be performed from already inserted catheters. Before the procedure, always perform hygienic hand disinfection and identify the patient by asking for their name and checking the identification tag. Compared to venous blood collection, we prepare the following supplies. Disinfecting wipes for invasive entry points. If a disinfecting cap is used, the entry point does not need to be disinfected. Cap and adapter, corresponding to the collection system. Two syringes with a volume of 10 milliliters filled with saline solution for catheter flushing. One empty syringe for blood withdrawal. Catheter cap. Test tube. Gloves of appropriate size. And a mission dish. The general procedure is the same for all types of catheters. Blood collection can also be performed through needle-free connectors based on the manufacturer's recommendations, which are disinfected by wiping or using disinfecting caps. Spray disinfection is not recommended. First, flushing. Before collection, the catheter is flushed with 10 milliliters of saline solution using the start-stop method to remove any medication residues from the catheter walls and minimize the risk of contamination and distortion of the collected sample results. Second, blood withdrawal. It is recommended to withdraw the necessary amount of blood for disposal. This can be based on the manufacturer's recommendations or by withdrawing 3 to 5 times the dead space of the specific catheter. With repeated collections and excessive blood withdrawal, long-term hospitalized patients may experience unnecessary blood loss. Dead space. The volume of waste blood needed for correct collection is a widely discussed topic. The amount varies depending on the type of catheter used. Third, blood collection. Using the adapter of the specific collection system, blood is collected for the required tests. Fourth, flushing. Finally, the catheter is flushed with 10 to 20 milliliters of saline solution using the start-stop method. Flushing continues until blood is no longer visible in the system. Flushing continues until blood is no longer visible in the system. Fifth, closing or connecting. Either the infusion line is connected or the catheter is closed using a needle-free entry and disinfecting cap. Specific types of blood collection from a peripheral venous catheter. Blood is collected from a peripheral venous cannula if it has just been inserted or is fully functional. At least 8 hours must pass after the end of a fat emulsion infusion and 1 hour after other infusions. If collection is necessary sooner, blood must be drawn from the other arm or from a site below the intravenous line, but never proximally from the infusion site. Arterial catheter. No medication may be administered into the artery, so there is minimal risk of sample contamination. Only a small amount of blood is withdrawn for disposal. When blood returns to the syringe, a maximum of 2 milliliters is withdrawn for disposal before proceeding with the required collection. Blood collection from a central venous catheter, CVC. The central venous catheter, CVC, ends in the cavoatrial junction, where blood can be collected without contamination. The widest distal lumen of the CVC is recommended for blood collection. Based on the catheter design and the blood flow rate at the cavoatrial junction, with an average cardiac output of 5 liters per minute, stopping infusions in lumens not used for collection is unnecessary. If the distal port is occupied, blood collection is preferably performed from the proximal lumen, which is recommended in cases where the distal port is in use.